Hello, my name is Jessica Amber Orozco, and today I will be doing my informative speech on cirrhosis of the liver. Here's my audience. Today's speech, its purpose is to inform you about cirrhosis of the liver and what it is and what it does to the body. What do you think causes cirrhosis of the liver? Could it be health habits, perhaps cancer or an autoimmune condition? Cirrhosis occurs due to necrosis of liver cells followed by fibrosis and nodule formation. Clinical manifestations of cirrhosis are related to portal hypertension, hepatic dysfunction, which progresses to liver failure, and development of hepatocellular carcinoma, conditions with unfavorable prognosis. How many people do you think are diagnosed with cirrhosis? Well, according to the CDC, about 633,000 adults are yearly affected by cirrhosis. Cirrhosis of the liver is rising in adults, and some of them are unaware that they even have it. I have researched cirrhosis of the liver because my father has been diagnosed with it due to alcoholism, and I would like to share what I have learned about it with you. First, I will explain what the definition of cirrhosis of the liver is and what it does to your body, as well as the treatments that are available for it. According to Google definitions, cirrhosis is defined as the histological development of regenerative nodules surrounded by fibrous bands in response to chronic liver injury that leads to portal hypertension and end stage of liver disease. When people think about liver disease, most of them relate it to having bad nutrition habits, but there are different types of cirrhosis that affect the liver, and one of them is alcoholism. Alcohol is a toxin. When you drink too much, your liver has to work extra hard to process it. To protect your liver, you must stop drinking, but this can be hard if you become dependent on it. In advanced cases of cirrhosis, when the liver ceases to function, a liver transplant may be the only treatment option. However, those with alcoholic cirrhosis have not been liver transplant candidates because of the risk that they will return to harmful drinking after the transplant. Liver transplantation remains the only curative option for a selected group of patients, but pharmacological therapies can halt progression to decompensate cirrhosis or even reverse cirrhosis are currently being developed. This concise overview focuses diagnosis, complications, management of cirrhosis, and novel clinical and scientific developments. The liver is essential for continued health. There is a particular concern when the organ experiences disease. It is the purpose of the remainder of this speech to explore this disease known as cirrhosis of the liver, its signs and symptoms, and its treatment and prevention strategies. The liver is the largest gland and second largest organ in the human body. It is also the only one capable of regeneration following injury. It is found in the abdominal cavity. This reddish-brown organ is divided into lobes of different size and shape. The liver plays a critical role in metabolism, digestion, elimination, and detoxification, amongst other processes. Cirrhosis is a slowly progressing disease in which healthy liver tissue is replaced with scar tissue that eventually prevents the liver from functioning properly. The scar tissue blocks the flow of blood through the liver and slows processes of nutrients, hormones, drugs, and naturally produced toxins. Cirrhosis is a complication of many liver diseases characterized by abnormal structure and function of the liver. The diseases that lead to cirrhosis do so because they injure and kill liver cells after the inflammation and repair, causing scar tissue to form. Treatment of cirrhosis is designed to prevent further damage to the liver, treat complications of cirrhosis, and prevent or detect liver cancer early. Alcohol and viral hepatitis B and C are common causes of cirrhosis, although there are many other causes. Cirrhosis can cause weakness, loss of appetite, easy bruising, yellowing of the skin, which is known as jaundice, itching, and fatigue. Diagnosis of cirrhosis can be suggested by history, physical examinations, and blood tests, and can be confirmed by a liver autopsy. The liver makes proteins and enzymes that regulates blood clotting. It also regulates cholesterol and stores the energy. In addition, the liver removes poisons from the blood. Cirrhosis is not curable, however, it is treatable. Doctors have two main goals in treating this disease: to stop the damage to your liver and to prevent complications. Alcohol abuse, hepatitis, and fatty liver disease are some of the main causes. Your doctor, however, will personalize your treatment based on the cause of your cirrhosis and the amount of liver damage you have. Cirrhosis often has no signs or symptoms until liver damage is extensive. When signs and symptoms do occur, they may include fatigue, easy bleeding or bruising, loss of appetite, nausea, swelling in the legs, feet, or ankles, weight loss, itchy skin, yellow discoloration in the skin and eyes, and fluid accumulation in your abdomen. It can also have spider-like blood vessels on your skin and redness in the palms of your hand. Cirrhosis causes the liver to shrink and harden. This makes it difficult for nutrient-rich blood flow to flow into the liver from the portal vein. The portal vein carries blood from digestive organs to the liver. The end result is a serious condition called portal hypertension, in which the vein develops high blood pressure. The unfortunate consequence of portal hypertension is that the high pressure system causes a backup, which leads to esophageal varices like varicose veins, which then burst, and cirrhosis can damage your liver to the point of bleeding, which is liver failure. Cirrhosis can rob your body of nutrients and weaken your muscles. To combat these effects, eat lots of healthy foods like fruits, vegetables, and lean protein from poultry or fish. Avoid oysters and other raw shellfish because they contain bacteria that could cause an infection. Also limit salt, which increases fluid buildup in your body. Be very cautious about medicines that can cause liver damage, such as acetaminophen, known as Tylenol. New scientific discoveries and medical breakthroughs are occurring daily. The appreciation is due to the equipment and the knowledge that exists today. Humans take advantage of their bodies, and when that advantage reaches a certain state where it becomes too much, it can be detrimental in concerns of living a healthy lifestyle. Many advances have occurred in the clinical care of patients with cirrhosis and complications of end stage of liver disease. The majority of these have focused on treatments of the underlying causes of cirrhosis and management of complications of portal hypertension. The next 10 years, you may see a focus on the primary prevention and treatment of cirrhosis. Examples are the use of non-invasive tests to screen for earlier stages of fibrosis and to monitor antifibrotic drug effects, and pharmacological targeting of fibrogenesis pathways. Continued basic and clinical research is the critical way to be able to finally remove cirrhosis, as it is an irreversible condition and a major contributor to morbidity and mortality in our patients. If you suspect that someone has any of these health symptoms, it is best to advise them to check with a doctor to further discuss potential treatment or transplant. Thank you so much for listening to my speech about cirrhosis of the liver.